Congratulations on joining our award-winning and nationally acclaimed 3D Lipo family. What is different about our machine is that we're able to treat an array of different body indications with our fantastic combination of technologies. Our three-dimensional approach is what sets us apart from our competition. We've put together this short training video to ensure that you gain a full understanding of how each technology can be applied individually or combined to treat multiple concerns. We hope that this video will help you deliver the fantastic results that 3D Lipo has become renowned for.
Hi, I'm Jo. Welcome to the 3D Lipo training facility. 3D Lipo has been designed with 4 technologies to work on an array of different body shapes. What I'm going to train you on today is how to apply these technologies to each body. The first technology that we're going to look at today is cavitation. Cavitation is for the clients who are looking for circumference reduction or also inch loss. Cavitation is an ultrasound wave that is emitted from the 4 transducers on the handpiece. As the energy is emitted, it will travel in an outward fashion. So at 3 centimetres beyond your head, all of your energy is combined together and you get a greater output. When the cavitation is emitted onto the surface of the skin will actually have a resistance. The energy will push, the skin will resist, the energy will win, but the byproduct from that resistance is a vibration. As this vibration travels down into the fat layer, the fat cells then start to mobilise and move around. Also then the energy from the transducers are absorbed by the fat cell, which creates movement in the form of expansion and reduction and twisting. Because of this movement, air pockets then start to create inside the fat cell, which will expand and get bigger. All of this movement plus the pressure from the air pockets will then put pressure on the cell membrane. This cell membrane then can't cope with all of this pressure, will start to break down and release the triglycerides that are stored inside the fat cell into the intercellular space. Once these triglycerides fall into the intercellular space, the body then has to enzymatically break them down because it can't cope with them as triglycerides, and it will break them down into 2 things, free fatty acids and into glycerol. Glycerol, because it is water soluble, is absorbed by the blood, taken through the body and utilised as instant energy, whereas the free fatty acids then, because they are insoluble, get picked up by the lymphatic system, taken through the lymph nodes and processed then by the liver and the kidney. A course of 6 to 8 sessions is recommended with your cavitation, and we do recommend these treatments to be taken on a weekly basis. After you've had your course of 8 sessions, we recommend that a 2 to 3 week break is had, and this lets the liver and the kidney cleanse through. During the course of sessions, we like the clients to follow a pre and post care to make sure they keep their body healthy, and they have to avoid alcohol for 24 hours before and after session. Also avoid any caffeine 2 hours before and after, and make sure they eat a healthy diet on the day of treatment. So now we're going to start the cavitation practical treatment. The first thing you need to do with cavitation is apply the gel to the surface of the skin. You need to make sure that you've got enough gel for the first reason to give you slip of movement with the cavitation head, but the second to make sure that the resistance between the skin and the head is lessened so the energy can go into the fatty tissue. When you're applying the cavitation head to the skin, make sure that you're not gripping it too tightly onto the skin and allow the cavitation head to be moved around but pushing the weight, so you're not holding the weight of the cavitation head on your arm. Nice circular motions, so you're imagining you're drawing the letter O over the area, and this letter O should always be the size of your hand and no bigger. And you need to make sure that you stay on that letter O for 5 minutes. During a cavitation treatment, you must always make sure that you're moving the head in a small circular motion. Never hold it still on the surface of the skin because it can be quite uncomfortable for the client to receive. So when doing your cavitation treatment, make sure that you're applying a good pressure on the surface of the skin and try and avoid any bones over that particular area. Also make sure you stay away from any lymph nodes. The pressure should be pretty constant through the whole circular motion. Also, it's important that you remove any hair from the abdomen or any other areas, as this will block the resistance of the energy going through to the skin and into the fat. If you find that during your 5 minutes of this particular treatment, the gel is absorbing into the client, then just lift your handpiece off, press pause on your machine and apply more gel to give you enough slip. If gel isn't applied, you will find that the resistance will change and the energy will be on the skin and create heat rather than affecting the fat underneath the skin. Once you've finished your first 5 minutes, what you'll then need to do is move to your second 5 minutes, apply the gel and work over the same area for 5 minutes again. So on this client, what we're going to be doing is 20 minutes of cavitation. Initially, we'll start around the side, so 5 minutes on the side area, 5 minutes on the middle abdomen, 5 minutes again, and then 5 minutes around the back. So concentrate the cavitation on areas of concern for the client. The second technology we're going to look at is radio frequency. Radio frequency is emitted through two handpieces, the 6 pixel and the 4 pixel. The 3D Lipo uses tripolar radio frequency. The major benefit of tripolar radio frequency is that it will emit into the skin the distance that the poles are apart. The 6 pixel handpiece will emit the energy 2 to 3 centimeters into the body, whereas the 4 pixel handpiece will emit the energy about 6 millimeters into the body. This means that the 6 pixel handpiece is excellent for what we call fat melting, whereas the 4 pixel handpiece is excellent for skin tightening. So the radio frequency works extremely well on cellulite and skin tightening. Radio frequency uses a very, very high frequency current that's emitted through these handpieces onto the surface of the skin. The skin will again resist, the energy will push, but because the frequency is a lot higher than it is with cavitation, rather than a vibration, the reproduction of this is a heat. So we are utilising a heat within the skin to create different actions within the body and within the skin. Your skin layers act as resistors, so the movement that is applied with radio frequency will affect the amount of heat that's produced on the surface of the skin. So it's important when doing radio frequency treatment that the movement application is extremely slow. The 4 pixel head is used for skin tightening. The aim of skin tightening is to get the heat from the 4 pixel head into the dermal tissue. Your dermal tissue will have a certain amount of collagen in there already, but depending on your age will depend on how much collagen you have. The aim of skin tightening is to increase this collagen production. We're going to use the 4 pixel head to push the heat into the skin. This at 40 degrees will have a disruptive act on the collagen fibres that are sitting into the skin already. This will have an immediate contraction on these collagen fibres, so basically causing destruction. This destruction then will start to stimulate fibroblast action, which will stimulate mitochondria activity in the cells to encourage cellular regeneration and cellular renewal. The most important part of radio frequency is to ensure that that heat on the skin is maintained for 2 to 4 minutes. As long as you can keep your 40 degrees of temperature for 2 to 4 minutes, you will stimulate a good amount of collagen fibres. The idea of radio frequency is that you do treatments regularly in a pattern to stimulate more and more collagen. So by the time you have reached maybe session 3 or 4 of your treatments, your collagen will be stimulated enough to plump up the dermal tissue. This will give an anti-gravity action, but also reduce the appearance of lines and wrinkles within the skin. The 6 pixel head is excellent for working on cellulite. The energy from the radio frequency travels into the skin 2 to 3 centimeters, so will hit the fat layer. What we try and do is create a heat within that fat layer of 40 to 41 degrees. Human fat will start to melt at 41 degrees. As the fat melts, those fat cells that are round will become thinner and thinner and thinner. We do recommend that with the 6 pixel radio frequency, a course of treatments is done again, but on a weekly basis. The energy from the 6 pixel head will travel 2 to 3 centimeters into the skin. So within one session, we are hitting 2 to 3 centimeters of fat. That will flatten those fat cells in that particular area. So the next time the client comes in a week later, we'll be able to get a little bit deeper. That will flatten the next section of fat cells. The next time we'll be able to get a little bit deeper, which will flatten the next section of fat cells. So these fat cells then will become flatter and smoother and give the appearance of a smoother looking skin. We do recommend once the course is finished that the client does have maintenance treatments with the 6 pixel radio frequency, and these should be taken on a 6-weekly basis. So now we're going to do radio frequency. The radio frequency you can use either 6 pixel or 4 pixel. Because of the area we're going to be treating, we're going to start with 6 pixel radio frequency. With the 6 pixel radio frequency, you need to apply a nice layer of gel on the area that you're working, but not too thick. You want just a nice thin film. Take your 6-pixel head and then make sure your foot pedal is easy to reach with your foot, starting at the top with your radio frequency mode on continuous, and then your RF power starts at 10%. Press start on your unit, but nothing will actually come through the head, no power will come through until you put your foot on the pedal. So when your foot is down on the pedal, what you'll hear is an emission beep, so you know that the energy is coming through. So when you're starting with your radio frequency, you must make sure that you're on the skin and you're moving, and then when you're ready and you keep moving, you put your foot down on the pedal. The action that you want with radio frequency 6-pixel is a nice slow movement in a flower-like shape, because the more resistance you have and the more contact you have on the surface of the skin, the quicker the heat will create. Once you've done 30 seconds at 10% on the 6-pixel radio frequency, you then need to turn your power up to 20. And you can either turn it up as you're working, so keep moving with the handpiece on the skin and just increase your power to 20, or you can keep moving on the skin, lift your foot off the pedal, come off the skin, increase your power on the skin, and foot down. You must ensure with radio frequency that you keep moving all the time whilst your foot is on the pedal. The other thing that you have to be really careful of is not to keep it still on the skin. If you keep it still, all the energy will go from the head onto that skin, and it could create a lot of heat for the client. So make sure that you keep moving all the time, and you're increasing and increasing every 30 seconds with your power. Once you reach about 50% power with a 6-pixel radio frequency, you'll find that your client will start to feel the heat coming through the skin. And your aim then is to bring that temperature up to 40 degrees. So now we're going up to 50%. Can you feel anything? Just a little warmth. So doing this for 30 seconds, what you'll see when you get to temperature, when you get to 40 degrees in temperature, is a slight erythema on the skin. If you find that your temperature is not rising very quickly, the best thing to do then is slow your movement down. The slower you go, the quicker you'll build that heat up. The skin's temperature normally sits anywhere between 34.5 and 36.5 degrees. So when you're checking skin temperature, as we were saying before, it needs to rise to 40 degrees. When you're doing your treatment, you'll find that the temperature of the fat will be 1 to 2 degrees higher than it will be on the surface of the skin because of the way the tripolar energy flows. Also, when you're measuring your temperature within the skin, you have to make sure that you're measuring exactly where the head has just been. The infrared thermometers that we recommend you use have an aiming beam, so it shows you exactly where the head is going to be touching the temperature. Now my temperature has risen to 37, so what I'm going to do is just increase my output on the system and slow the movement down to try and build that temperature up a little bit more. So the slower you go with your radio frequency, the quicker you'll build up the heat. But as with other technologies, we do recommend that you avoid any lymph nodes, also avoid any bony areas as well, because the energy is absorbed very quickly through the bone. So I'm going to go up more to 90% now on the system. Do tend to find doing radio frequency that I can generally reach a temperature of 40 degrees on the skin surface, anywhere between 70 and 100% power on the machine. So going up to 100% with a 6-pixel is absolutely fine. So we're now measuring 39.2. So with what I'm doing now, the temperature is rising, so I'm going to keep my unit at 90%. Do this for another few seconds and then test the temperature again. So now we're at 40 degrees. What I'm going to do is start to speed my movement up now, because if I kept at the same speed with my movement, that temperature would just keep rising and rising and rising. And it's important that you keep the skin temperature below 45 degrees. So it has to be anywhere between 41, 42 degrees. If I speed up now, what will happen is that 40 degrees temperature will maintain, and I'm going to maintain that now for 2 to 4 minutes. On your unit, you've got a timer that's ticking down with your time, so I'm just going to time it using the timer on the system. During that 2 to 4 minutes, what you must do is make sure that you maintain that temperature If the temperature is dropping, if you're dropping down to 37, 38 degrees, then you need to slow your movement down to build that temperature up. If it's going too high, then you speed your movement up to maintain it well. So we're still at 40 degrees. So once you've done that for 2 to 4 minutes, what you must then do is keep your head moving, keep it moving all the time. When you're ready, then take your foot off the pedal first and then take your head off the skin. And you can see that there's a nice erythema. Do make sure that whilst you're maintaining your heat, you keep your head on the skin all the time, because as soon as you come off, the skin temperature drops very, very quickly. So I've only been off now for a few seconds, but I'm down to 39 degrees. So keep it on the skin all of the time. So once you've completed your first section of radio frequency, then you need to move to the next section to complete that area. And again, when you're starting on the next section, you must make sure that you work down again at 10%. So at 30 seconds increments, so 10% for 30 seconds, 20% for 30 seconds, and so on, and increase that until you reach temperature again. So your radio frequency is done in an area the size of your hand, and that will take anywhere between sort of 5 and 12 minutes, depending on how quickly the skin temperature will rise for that particular client. With 4-pixel radio frequency, we're going to use this head for skin tightening. The medium that you can use for 4-pixel can either be the gel or it can be glycerin. Glycerin feels a lot more comfortable for the client, but it will take a little bit longer to build up your temperature to 40 degrees than the gel. If the client is feeling very uncomfortable with the gel, then you can use the glycerin as I'm using today. To start with your 4-pixel radio frequency, again on the settings you need to be on continuous mode with your RF mode. RF power starts at 10%, but what we do with the 4-pixel radio frequency is increase that every minute, so you're gradually building up the temperature to again 40 degrees. Press start on your system, but nothing will actually come through the head until again you press your foot on the pedal when you get your emission beep. You must make sure with a 4-pixel radio frequency that you're on the skin, a good firm pressure, nice circular motions, and then when you're ready, your foot then goes down on the pedal. So nice steady treatment. Again, you're following, as with the 6-pixel, a nice kind of flower motion over the area, and we're working at 10% for 1 minute. I generally find that I can reach temperature with the 4-pixel radio frequency at anywhere between sort of 30 and 50% power on the system. So after you've done 10% for a minute, we then turn it up to 20 and apply that over the area for 1 more minute. As well as the 4-pixel radio frequency, you need to make sure that you are not keeping it still on the skin at any point. It needs to be moving all the time. But also make sure your circular motions are large. What you don't want to do is have tiny little motions like so. You need to make sure the circles are big and even, because if you stop at any point or you become really, really small with your motion, that heat for the client will build up and it will become very strong and sometimes uncomfortable. So nice, steady circular motions. If you do decide to use the glycerin as your medium for 4-pixel radio frequency, you will have to take your power up a little bit more. So generally I find I can reach temperature at anywhere between sort of up to anywhere up to 70%, whereas if it's with the gel, I then tend to work at about 30% power maximum. It's really important when you're working with the 4-pixel radio frequency that you keep all the 4 pixels on the surface of the skin. If you lift off the skin, what will happen is that the energy will be looking for somewhere to go to, and it'll end up going to the skin, so your client will get a small prickle. So make sure that you keep all 4 pixels on the skin and you're not having a twisting action with your wrist. So keep your wrist firm and then nice big circular motions. With the 4-pixel again, make sure that you're concentrating on a small area, so you're not diversing that heat too much. If your area goes too large, by the time you've done one side and then work down to the other, this side will have cooled. So make sure your area is not too big so you can intensify that heating of the skin. So once you reach temperature, once you reach 40 degrees on the skin, then you need to speed your movement up to maintain that heat. If again the temperature is dropping a little bit, slow your movement down to build it up. If it's getting too hot, then you'll need to speed up. So just make sure that you're maintaining a good 40 degrees in temperature so you get that collagen stimulation in the dermal tissue. When you finish your treatment then, you must keep your head moving all the time. When you're ready then, take your foot off the pedal and come off the skin. 3D dermology is suitable for most clients after their treatment. We do recommend that it follows cavitation, also radiofrequency, to encourage waste removal and drainage through the lymph system. The principles of the 3D dermology are vacuum, which is emitted through the little hole in the end of the handpiece. This will then draw the skin into the head. The rollers then will give a pinching action. This has a fantastic effect on increasing blood supply to the area, also encouraging lymph movement. So the therapist will hold the handpiece onto the surface of the skin, glide it then towards the lymph nodes to encourage the drainage. This will also increase the blood supply to the area, and the blood carries oxygen and nutrition. This will also encourage feeding the cell tissue and allowing the blood flow to be greater through the skin. It will also help with relaxation of the client as well, so it's a nice way to finish off the treatments. Now we're going to go into the 3D dermology. This 3D dermology application is for the Lipo Plus. To start, we need to put massage oil onto the client's skin. Just a normal massage oil is good. Apply this gently over the area, but don't massage in too much. You need to leave a little layer on the surface of the skin. The idea of the 3D dermology is to take the waste that's been produced by the cavitation to the lymph nodes. So on the abdomen, we're going to be working from the waist to the iliac nodes just underneath the belly button. On the 3D dermology head, you can see that you've got your vacuum, your roller action. There's also two blue lights which will show you the direction of the roller. When you're doing your dermology, we're holding the head like so it's nice and firm. The lights then show you which way the roller is moving. You always need to have the roller in the direction that you're facing. So we start working over the abdomen. Hold it for 2 seconds to get the suction, glide down then towards the lymph nodes, and then use your little fingers to break the seal. So as you're coming down, you're pushing your little fingers down to break the contact between the head and the skin. The next movement then is a little bit further down, so coming across, down towards the lymph nodes and break the seal, and then from the top. This action needs to be repeated over those areas again until you see a really good erythema that's going to stay for at least 1 to 2 minutes. When doing the dermology, it's always good on the abdomen to pull towards yourself. So when you want to come around to work on the other side, come round the bed and then pull towards yourself from the other side. The next section is a 3D dermology RF. This is excellent for working on clients who have cellulite, but also after any cavitation or radiofrequency treatment. There's different elements to this handpiece. The first one is the vacuum. The vacuum will pull the skin into the head. This will encourage drainage of the lymphatic system and also increase of the blood supply. We also have rollers on the head which are mechanical. These have 3 different functions. They will roll up, which is excellent for lymphatic drainage. They will also both roll in, which has an excellent effect on working on cellulite reduction, or they will roll out, which is excellent for smoothing the skin tissue. The radiofrequency then is emitted from the head, which is bipolar. This will encourage blood supply increase to the area, also heat, so the actions from the roller and the vacuum are increased. So excellent for working on cellulite after the 6-pixel radiofrequency or after cavitation. So dermology RF is probably your last part of the treatment if you're treating legs for cellulite and so on. You may have done cavitation to start with, followed then possibly with 6-pixel radiofrequency, then we would move to finish with the dermology RF. On your system, go into the dermology RF and we'll start our vacuum power at 10%. Your radiofrequency mode then again needs to be on continuous, and this is also used with the foot pedal, so make sure your foot pedal is to hand during the treatment, and we set the RF power at 50%. You have 2 options underneath on the vacuum mode, your M1 and M2. M1 we recommend for softer fat, M2 we recommend for hard fat. Underneath then you have your roller motions. You've got 4 options on the system. Robo in is where both rollers are going inwards, and this gives a pinching effect, so excellent for working on cellulite. We've also got robo out. Robo out is where both rollers are going outwards and it has a smoothing effect, so really good for working on looser skin. Then we have robo up 20/80, robo up 50/50. Both of these are lymphatic drainage action. So when we do the treatment on the client, we actually start with Robo up 50-50 to do lymphatic drainage. We then treat the client with either Robo in or Robo out, depending on their concerns. And then we finish with lymphatic drainage again, Robo up 20-80. So depending on your client's concerns will depend on which roller action you use. So on this client, I'm going to start with Robo up 50-50, press start on the system, and your actions then are going, you have your vacuum coming from the head, plus your roller action. When you're doing your dermology RF, you need to make sure that you're on the skin first of all, and we're going to be working towards the lymph nodes on the inside of the thigh. So starting on the skin, grabbing your suction, foot on the pedal, working across, a foot off the pedal and walk off. Then move across to the next one on the skin, going up, foot off the pedal, come off, and then over to the next section. This action then wants to be repeated 3 times, so we're doing 3 movements 3 times. So on the skin again. Once you've done that 3 times, then you need to do what we call the pumping action or the bouncing action. So you pause your system. You will then choose your action, either Robo in or Robo out. So we're going to be working on cellulite, so we're Robo in, press start, and then we need to follow a grid pattern on the area. So starting at the bottom of the thigh, taking your suction, foot on the pedal, and we follow a bouncing action going forwards, and then moving up, bouncing action, coming back, then up, and then back. We then need to turn the head sideways on and work down, and then up, and then down. So that's one pass. We then need to do that again twice, so 3 times in total. So on the skin, bouncing action across. So when you're bouncing, you're pushing rather than pulling to make sure you keep contact of the skin. So once that's repeated 3 times, then you go on to your next section. So pause the system, Robo up 20-80. The difference in this action is that you've got one roller that's working faster than the other. So you're feeding into the head a little bit more. So press start, and then you do your lymphatic drainage movement again. So starting from the bottom and working up towards the lymph nodes. So when using the dermology RF, that process can be followed for every area of the body. So same for the abdomen, same for the front of the thigh. So always make sure you roll up with 50-50 to start with, then do your bouncing motion with Robo in, Robo out, and then roll up 20-80 to finish. Cryoelectrophoresis is for working on pockets of fat and basically is fat freezing. We've got 2 sizes of heads that we use for 2 sizes of pockets. The elements that we have on the cryo are vacuum initially, which comes out from the central section. When this is placed over the pocket of fat, then we create a seal across the head. The vacuum then will pull the fat into the cup. These plates then will chill down and freeze the fat to -5, -6 degrees. Your fat will freeze from -1 beyond. If we can freeze the fat to about -5, -6, we know then that we will have a crystallization on the fatty tissue. As the fat then gets affected and gets colder and colder, it will start to crystallize and start to change state. As it changes state, your fat will have an inflammatory response initially. This inflammatory response will create damage to the cell along with the fat freezing. This will then need to be on the skin for approximately 45 minutes to an hour. During this time, the cold will go from the outside of the plates all the way through to the inside to affect a lot of the fat cells that are in that particular area. We generally say that after 1 session of the cryo, you can generally reduce anywhere between 20 to 40% of the fat cells that have been drawn into that head. As the cells then start to shrink, the macrophages will come in, break them down, and the body then will take the waste away through the lymphatic system, so it's processed then through the liver and the kidney. We do find that because of this process, it will take 2 to 4 months for results to start to show with cryo. The cryo then shouldn't be applied on that same area again for at least 6 months to ensure that the full effect of the initial result has been achieved. What you will expect to find after cryo, because of the coldness that's been on the surface of the skin, you will get an immediate redness and also the area can possibly be swollen. We do say that clients can experience localised numbness. Most often that is reduced within about 2 to 4 hours, but in some cases it has been experienced to last for up to 2 months. We do find as well that the area can be quite cold and quite firm after treatment and can feel very uncomfortable for the client due to the numbness. And because of the vacuum within the head, bruising can occur and last for up to 10 days. It's important when combining your treatments on 3D lipo and possibly following a week later with cavitation that all these symptoms have passed before you continue with your treatment. So doing the Cryo Duo application on the Lipo Med, you need to make sure that your client's laying down so the area is accessible and you've already marked the 2 places that you're going to apply your cryo head. Also marking the line of the pocket so you know exactly which way your head is placed and then the centre point. We also need to make sure that the middle square of the cryo pad is placed right over the square of where the pocket is. Apply nicely, making sure that you don't have any air bubbles in the cryo pad, but also at the same time making sure that you keep the pad full of fluid. This will ensure that the skin is protected from the freeze, but also doesn't stick to the plates on the head. Your second pad then needs to go onto the skin. In exactly the same manner, but also ensure when you're doing a Cryo Duo that each head is at least 3 centimetres apart from the other, because the vacuum obviously pulls the skin into the head. If the heads are too close together, then there'll be too much stretch on the skin in the middle. So you need to make sure you've got at least 3 centimetres. We've got plenty of room here, but just be careful when you're applying on the abdomen. So a nice light movement to take the air bubbles away, so not too much pressure. When you're applying the Duo, then make sure that you apply one head first of all. So you have your central point on the head marked by the V. This needs to be aimed where your cross is. Glide down to make sure that your cross is right in the centre of the head. Then when you're ready, the application goes on. Pressure downwards, keep applying the pressure until the vacuum stops the pull on the skin, and then release. This head can then be supported by a rolled towel underneath so it doesn't cause any discomfort for the client. Just move your arm just a little bit to the side, please. The second application then needs to go on in the same way, so making sure you're lining up your V with the cross, apply your pressure, nice and firm until the vacuum stops, and then you can release. Using the medium head on this area means that this has to stay on the skin then for 45 minutes, so you have to make sure your client is nice and comfortable and be able to spend that time on the couch. So now we're going to go through some maintenance of the 3D lipo. When you're finished using your heads, what we must ensure is that the gel is removed from the head straight away. So once you finish your cavitation, take some bedroll, wipe away the excess of the gel. Then you must use the sanitizer provided onto cotton pads or onto the tissue and wipe over, and it sanitizes the whole area, making sure you get in between the transducers as well. Same with the 6 pixel radio frequency head and the 4 pixel. Each one should be sanitized after each individual use. When you're looking at maintenance for your cavitation head, the best way to check your head is still in good working order is if you're going into cavitation on your system, into manual selection, and then you start your unit on continuous mode. Your cavi power then needs to start at 10%. When you're working on 10% and you press start, you will hear a hum from the cavitation and all 4 transducers should be buzzing through. As you increase your power, when your cavitation head is running, the closer you get to 100%, the quieter your cavitation head should be. If you're finding that your cavitation head is still quite loud at 100%, it will mean that your cavitation head is running out of hours. Also, if you find that your client is finding the cavitation head very hot, or also they're not getting as good a results as they would normally get, it could be an indication that your head is running out of hours also. Also check with your cavitation that your wire is in good condition and it's not too twisted and curled around. Because of the nature of cavitation with the circular motions, occasionally the wire can loop. So take it out from the back attachment, move it down, make sure there's no loops in there, and then apply it back into the head. What you must always make sure is that your cavitation head is attached to the back of the machine. As the machine is switched on, it will do a cavitation test, and if there's no head in the back, then it will give you a warning beep. So always make sure your cavitation head is attached into the back of the system. When looking at the back of the unit, the things that you need to pay attention to, first of all, are the filters at the back. The Lipo Med has 3 filters for every vacuum outlet, whereas the Lipo Plus will have 1. You need to make sure every day that these filters are clear. If they have fluid in them, it will be from the cryo solution from the vacuum attachment or possibly from the vacuum roller. If you do see fluid in the filter, you need to unscrew the filter all the way down, empty it out, dry it, and then put it back in. Do make sure though that you find your O-ring that will sit sometimes inside the gold box here. Unscrew the filter, take your O-ring out, but make sure your O-ring sits on top of the filter when you screw it back in. If your filter is not in tight enough or the O-ring is not in place, you will lose vacuum on your cryo attachment and your vacuum roller. So just make sure when it's put back in, it's nice and tight. Every so often, when using your cryo, you will need to top up your cryo water inside. Inside the unit, you've got a tank that will hold 1.5 litres of water. You'll have 2 tubes with your system, one with a funnel and one without. The one with the funnel goes into the water entry outlet at the top. The one without the funnel, when you're topping up, will go into the exhaust hole at the bottom, so diagonally underneath into the exhaust hole. You'll then push that into the machine and you get a little outlet of water at the bottom. Make sure you have a bowl at the bottom to catch the water. So when you have your tubes attached, you need to then take your water. This needs to be deionized water or purified water, and start then to fill your funnel. It's important when you top your machine up that you keep your funnel full with the water. What you mustn't do is fill it, let it drain, fill it, let it drain, because that will put air inside your tank. So you need to make sure your funnel stays full, so we'll push the air away. When you've got the same amount of water coming out from the exhaust hole tube that you've got going in at the top, you know then that your tank is full. If out of the exhaust hole you've got lots of bubbles and lots of an inconsistent flow, then you must make sure you keep filling until exactly the same flow is coming out from the bottom as going in at the top. We do recommend then that every 3 months your unit is completely drained and refilled with fresh water. When you completely drain your unit, have your tube in at the top, then your second tube must go into your water exit. As you click that in, you will get the full 1.5 litres of water coming out into your bowl at the bottom. When it stops, it's obviously empty, so when you're ready then to top it up, you put it into the exhaust hole, click it in, and then start to fill as we've just done at the top. And again, obviously when the air's all through, it's full. This process also has to be done if you're going to do 2 consecutive cryos. If you've got 2 cryo treatments, one straight after the other, you need to drain and refill your water tank so the water is cool enough to chill the heads down to the -5, -6 degrees. When attaching your cryo to the back of the unit, you must make sure that the smooth part of the cryo head is facing upwards, the indented bit at the bottom. As you're pushing it in, make sure you give it a good firm push, and you'll hear 2 clicks to ensure that it's into the machine. When you're taking your cryo head out, you squeeze the buttons together and then gently release. When you're applying your cryo head to the client, you must also make sure that the head is upright and not upside down. If your head is upside down, what will happen is the fluid will be drawn in from the vacuum port and you'll start to see it ending up in the filters at the bottom. So make sure the cryo head is upright, or slightly tilted is okay, but not upside down. In the Demology RF, the other thing that we have to be careful of is the filter that's inside the handpiece. You'll have a hook with your system. There's a grommet which holds the filter in that you can take out with your hook. This filter will probably need to be changed after each Demology RF client. You'll also be supplied with a bag of filters. The new filter then goes into the area and then you'll cover it over with the grommet to make sure it stays into place. If you need any other information on the maintenance of your system or for treatments, then please refer to your operations manual or your training manual where you'll see photos of the treatments being done, also of the filter change on the system. If you need any other information, please call.